Hello, family and friends. It is Saturday, the 7th of September, and we are on our way to Joe's MRI appointment. Oh, yeah. Gotta be careful, we're crossing the street. So, Saturdays, the Texas Medical Center isn't bad at all to walk. There's not that much traffic. There's Joe right there. He's getting nervous about his appointment. But today's just an MRI. We won't know for sure if the radiation worked until Monday. But wish us luck.
Hello. A little nervous, even though my results don't come back to Monday, but got a little nervous. Had a little small little nosebleed, nothing to worry about. That's what happens when I get nervous. But God's here for us. God's blessed us so far, and He'll continue to bless us. But and I hope they always have a problem here, or anywhere like chemo, whatever. They always have a hard time. Uh,
Fight a vein.
in my vein. Yes, I do have problems walking on rocks and stuff like that, so it's kind of scary. That's why I was going to Christina on walking off of ledges, or not ledges, but curves and rocks. But just say a prayer for us that hopefully results come back Monday and the cancer shrunk. I'm always going to have cancer, but I know it's scary.
But the doctors are just trying to keep it at bay.
So I can live as long as I can. All right, well, family, thank you. Love y'all. We'll see you a little bit.
So this is our walk to his appointment from the hospitality apartments. I've been like really eyeballing these apartments back here. You guys know that we're gonna move out of Austin and come back to Houston and stay in these cancer shelters. But I'm also thinking like, looking for apartments and also applying for jobs. Because we don't know how long Joe's going to, have to be here in Houston. So if we have to stay permanently, I think this is the area I want to stay in. It's close to the hospital and there's little things here and there. But the walk to the hospital is what's appealing to me, that everything's close to the hospital on this side. On the other side that we're staying at, Drake, that's like really ideal because of all the stores and everything. But we'll see. I'm gonna pray for guidance that God tells me what it is I need to do, what job should I get, or if I should get a job at all, and just completely just focus on taking care of Joe. But money is extremely tight and a huge worry, a huge burden on us. But yes, if there's a way I can get an apartment close to where I'm staying at now or in this area, it'll be a blessing either way. It's a nice day. It's a lovely day today. Pretty flowers. We will find out on Monday if the radiation worked or not. Keep us in your prayers. You guys see the fish in the water? All this area right here is brand new. All this. Yeah, they have like some steps you can sit on over there in that corner too.
have ping pong tables. You can have football table. Another water feature. The ping pong table.
You wanna go look over there? All this is like space for rent, retail rent. There's a fitness center in here. I think it's like another water feature. Wow, there's cool stuff here. This is all brand new. They started on it a year ago. Midnight. A lot of retail.
move. These little moves. It kind of looks
Like a mini mall.
like the library who's on top.
Mm-hmm.
It says play, learn, play, something. They got a soccer field. Oh, they're looking around. Yeah, UG game's about to start. That's a fun looking tables over there. I'm sorry, baby. What you gonna make? What you gonna do?
You're still working on it too. Like there's gonna be stuff over here. And this is where our car is at, back over there.
We're at MD Anderson. When they get my results for my MRI, my MRI. Hello, family and friends. Well, I'm in the back waiting for my doctor to come talk to me to see if it's changed or if it shrunk or anything like that.
Hi, Mr. Hippolito.
Hello, how you doing today?
Good, how are you?
Okay.
Nice to meet you both. My name is Jacob. I'm a medical student working with Dr. Uvo. Today, you won't just see me. I'm here to kind of just get the visit going, ask questions, and see how you're doing. And then she'll come in just a little bit.
Okay.
Sound good?
Mm-hmm.
All right. So overall, I know the nurse might have asked some of these questions, so apologize if I'm repeating.
It's okay.
But overall, how are you doing? Anything in particular bothering you?
Everything's going good.
Okay, so feeling well overall? Okay.
Feel a lot better
Good.
than last time.
Yeah, okay, perfect. Any headaches?
No.
Okay. No headaches, vision changes?
I think my vision, my double vision got a little bit better.
Oh, good, okay.
So it's not as bad as what it used to be. But like sometimes I do have like, I don't know, my like glasses are too strong or what, but they did an eye check and they said my vision did get a little bit better. So
Oh, good.
maybe it's just, they get better vision right now.
Okay, good. All right, so no headaches, vision changes are actually improving if anything?
Yes.
Good. Any nausea or vomiting?
No, sir.
Okay, good. All right. And then how about any changes in your balance?
It's been the same. It's not really balanced, but it's like trying to go off ledges or walking downstairs. It takes me a while to have my eyes adjust, but it's nothing really like balance at all.
Got it. So like kind of the depth perception.
Yes.
More so. Okay. All right. So, but not balanced like you're
No.
standing, having
No.
issues. Okay. Okay. Good. All right. And then any issues with either bowel or bladder incontinence?
Everything's good.
Perfect. Okay. Sounds good.
Yeah.
All right. And then any change in sensation or kind of a tingling or pins and needles sensation anywhere, any of your extremities? Good. Okay, perfect. All right. So what I'll do next is just kind of physical exam. I'm sure you've gone through it quite a bit, just kind of the cranial nerve exam, strain sensation, things like that. Okay. All right. So first, I'm just going to use my flashlight on my phone since that's not working. So I'll have you go ahead and look at my nose. And I'm just going to check for your pupils dilating or not. Okay. All right. Next, I'll have you go ahead and follow the tip of this pen here without moving your head, okay? And then next, have you go ahead and cover your right eye. Okay, and with your left eye, I'll have you just look at my nose. And with your peripheral vision, can you see how many fingers I'm moving?
5.
Good, okay.
3.
Good, and the other side, have you cover your left? Okay.
1. 3.
Okay, how about here?
4.
Yeah, perfect, okay, good. All right, and so the next, what I'll have you do is, let me know, does this feel the same on both sides? Okay, feel the same on both sides?
Yes.
Feel the same on both sides? Good, no numbness, perfect. All right, I'll have you close your eyes and tell me which ear you hear me making sounds in, okay?
Left.
Okay.
Right. Both.
Good, okay, you can open your eyes. All right, so next I'll have you raise your eyebrows. Okay, don't let me press them down, okay? Good, and puff out your cheeks. And don't let me push the air out. All right, and then big smile with mouth open. Like, good, okay. All right, and next I'll have you stick out your tongue. Okay, and I'm just gonna look at the back of your throat. So I'll have you say, good, okay. And any issues swallowing at all? Good. And I'll have you go ahead and shrug. Don't let me press down. Perfect. And then feel the same on both sides? Feel the same on both sides? Okay. All right, I'll have you go ahead and grab my fingers and don't let me pull. Good. And then go like this and don't let me pull your fist outwards, okay? Good. Don't let me push it in. Same thing on this side. Good. Great. All right. Next, I'll have you go ahead and raise this knee up to the ceiling, just kind of like that. Yeah, and don't let me press down, okay? Good. Same thing on this side. Good. And I'll have you kick this leg out like a soccer ball. Good. And the other way. Good. Kick this leg out. And the other way. Got it. Okay. And out again. Good. Okay. And go ahead and raise these. Or we'll do one at a time. You guys see this up. Don't let me press. And this one. Good. Feel the same here? Same here? Good.
Your nose is bleeding.
Good.
Hi, how are you?
I'm doing good.
Good to see ya.
Good to see you too.
Oh, awesome.
It started falling out bit by bit. But
Oh, okay, got it. And is this any part shaving or is it all just the falling out?
That's the falling out.
Okay.
but-
falling out, she shaved a little bit.
Just to, yeah, because I saw I got a lower, but yeah, definitely the pattern in terms of like it's definitely the radiation for this, like kind of. But I always like to ask if like if it fell out just like all of it, or they also help shave it. Because you can see here he lost completely the hair. Here he has a little bit more.
It was mostly like pretty long up here, then it started like getting like skin and then little dots, and then it was a little more skin.
And just like a little while ago, like a few seconds ago, he had a nosebleed, so.
Oh, no, yeah. So fortunately though, with the nosebleeds for this though, because he had essentially a nasal or cancer, is that we always like to make sure, does it overlap with those fields or not? And the answer is like no. So we're not that part, unfortunately, in terms of that. But yes, we did have ENT, like your ENT doctor, who made him aware, and he said he was going to touch base. So I'll have you lift up your glasses for a second. Oh, I know. And look straight ahead at me. And you follow my finger with your eyes. Okay. All the way down to the corners. Okay, good. All right. So this is what I'd say your MRI has a really beautiful response. We don't have the final read, unfortunately, but I will show you what the things are that I'm looking at for the response of what was radiated.
Okay.
Now there is one area. So the area that was where we could see tumor essentially a month ago, or actually got that, which is really beautiful. There is one area though that didn't have anything there before that now we see a little something. And I know that's the hard part. It's like the hard. But having said that, it doesn't mean that it's actually really something. And that's the reason why I think I've been kind of waiting on radiologist report. If that wasn't there, I'd probably be able to kind of be like, oh, this is absolutely fine. But it sometimes can be something questionable, but what it does oftentimes mean is that I repeat an MRI in about 2 months and 8 weeks in a short interval just to confirm. Sometimes those things can be vessels, sometimes they can be dura, sometimes it can be that there's something else there. And we'd have to discuss at that time, what options are. But the key part being that for what we, could save everything before it looks really good. So you responded well to radiation treatment. And I would probably say the first part is that we have to just wait to find out what this other questionable area is. So let's take a look at this scan just so that you can see it for yourself.
It's a little good news.
Yes.
I noticed I noticed when it was working because he started making sense. He wasn't confused anymore. He was having full conversations.
That's beautiful.
And he wasn't second thinking his words. I was like, you know what? In my heart, I feel like it worked.
Yes. No, I think you have a nice scan, and I'll get a chance to show the future Dr. Maps here. Also, this as well as you. So.
He was kind of having a little bit of complications how to pick it up, so he's like, we'll just wait for her to come in.
Oh yeah, I was trying to navigate this.
No problem.
Yeah.
So I'm going to do a little bit of dual talking. I'm going to say some things that are going to be super technical, they're going to be for fast, and then I'm going to say some things that are more geared for you. So this is the T1 sequence, and we're going to look at that. Predominantly as opposed to some of the T2 and flare sequences that would be more for like edema, things like that. So what we're going to do is compare that to his July scan on the T1 contrast sequence, and this will be for both of you guys now.
Yes.
So what you can see here, so this is what this is looking from the top of your head. You're kind of used to this a little bit. So this is where the tumor was before. You can see here comparatively. Look at this. You can see that all that. Like this is more, so some of this is also kind of like fluid and blood product. Okay. But look at this as like active, sort of like more, you could say like, I want to say like highly cellular or chunky tumor. You could say, think of that, like highly active tumor. And look at like, it's no longer that active.
Wow.
See, this is more of like that fluid that we're seeing afterwards, and you see how much flatter it's gotten.
So that's shrinkage, or is it disappearing?
That's shrinkage.
Okay.
No, so not disappearing, and I think we talked a little bit about this before, that like up front, this is not something where we're entirely anticipating all of it disappearing with these, and more often actually when we talk about the data for clinical local control, it's based on stability.
I see. Okay.
So when they read it and they say their local control is going to be 90% at this or 70% at 1 year, like it's all based on stability, not necessarily like for this type of fractionated therapy.
That makes sense.
And so this is so this is just to show you that, like, look at that, like this
That's good.
all that got, it just got so much smaller, okay? Yeah.
Now
And then
I
the
know why
other
I'm making-
area,
Now I know why I'm making sense now.
yeah, and the other area was this here, this got way better, look at that, it's like flat,
Wow,
Wow.
that's
see
good.
that, okay.
But the
So-
part with the fluid was the part that had the blood, right? The one that was bleeding.
Yeah, so it had blood before, and this also still has blood, but this essentially is responding. It's sometimes it's what we call necrotic, means that it's like tumor that's dying, and when it dies, it can also sometimes get leaky, like those cells are so there's sort of like this fluid here.
Okay.
Now there is an area, so you will notice, and this will for future doctors, but do you see that like here? That's just like so that could be on a dural. Maybe plaque or something, we can't tell, it wasn't there before, so this is all vessel, so we can't be sure, but what we're gonna need to do is like repeat his imaging in a shorter interval, so that we can track it. We always put margin on anything that's along dura because sometimes those things can hide, and so this was far away from what would have been any of the other areas that would have been margin.
I see.
Because as you can see here, what we do is we contour based on anatomical connection. So this is here, this is technically not connected the same way, right? So you technically have to go all the way here and come this way along dura or falx. So this would not be, proximity doesn't necessarily mean anatomical proximity,
I see,
right?
that makes sense.
So we're contour along the falx because that would be the pattern, or along the dura or trap, exactly.
Gotcha.
So this is not, but we
Why
do
would
put
it be
essentially
this
like
much?
almost 2 centimeters additionally on these things, and so this was not close. It was more than that by far, if it's something. So just to say that but we have to keep an eye out on that.
And
I have a
Thanks for
feeling that kind of radiology takes a little bit of time to read this. It's because they're also deliberating a little bit, right? So they're thinking hard about. But one other thing I can kind of do is that, so you use a lot of your other sequences to kind of try to triangulate and see. It's only really on just
So
slice, so sometimes it can be vessel. It's hard to tell.
My question is, if
Sometimes
it
it
is
could be real.
something, will we have to go get radiation again? 'Cause I know you can't get radiation in the same spot twice.
So that is something we'd have to discuss. My preference is typically to see what it looks like at the 8-week scan.
Okay.
The reason why is that maybe this is nothing and it's just like a vessel. Sometimes like along these things, it can just be the way it got cut at the time, right? Because
Okay.
it's so small and in there. The other thing is that, let's say, it makes people just worried unnecessarily in between that time for the 2 months when we can't be sure. Because
That's me.
yeah, so that's why I say it's not. I would rather just say we think it could be nothing, but we don't know. It could, if it's something, we just need to check sooner.
Okay.
If there's something that needs to be addressed, we can't just talk about like what it looks like. Then we have to look at also what the rest of the brain looks like in terms of like what the options are. So I would say yes, there are options likely, but let's not go
too
down
far.
that way.
Okay.
We don't have to go too far.
Okay.
Okay. So, but we'll get a better sense in about 8 weeks and we'll know.
But I'm surprised it's strong.
Yeah, no, but for what was visible, it looks really nice, like much better.
Thank
So
Jesus.
yes. Any other questions for me?
Mm-mm.
Okay. Well, the other thing that I do is I pull in his plan into like our prior treatment plan, which is what I was talking about with the Ray Station, so we can see what that area received before.
That makes sense.
Then from there, that kind of goes into like some next questions, but those are sort of the thought process in that. Of course, if you have any issues in between, you headaches and something, always just let us know.
Yeah.
I think though for the chunky disease that was there that's causing, I think that's like just responded really well, so I'm not anticipating that. But you know, we always like to let you know, like anything that also changes that's new, please
But can
contact
they
us.
grow back still in that same area?
Always hypothetically.
Okay.
So hypothetically, cancer unfortunately is one of those things that, we're gonna keep fighting. But the good thing is that it hasn't right now and it's responded really well. Which is, so I'd focus on that. And then also that we talked about in terms of like the local control, meaning being able to control the tumor with this type of dose and radiation at 1 year is like, 70% or greater.
Nice.
All right.
So glad.
Okay, so happy for you, okay?
Thank
Hoping
you.
everything else from there
I'm
goes
happy.
smoothly.
I'm happy too. At least we got
Yeah.
something taken care of.
Yeah, exactly.